The fifth core element of the zero suicide model of approach addresses treatment. The treatment of suicidal thoughts and behaviors directly in the least restrictive environment, providing safe suicide care. We're going to talk about what it looks like to treat overdose risks and behaviors directly, some of the current barriers to evidence-based care at this time the field is addressing, as well as the available approaches such as medication-assisted treatment. We're going to talk about the stepped care approach to substance use treatment that mirrors the zero suicide idea of providing care in the least restrictive environment appropriate. When looking at evidence-based care specific to reducing the risk of overdose, unfortunately, at this time, there is a significant evidence gap in effective treatment. This is something which the field is actively trying to develop and research. There's a lot of research going into evidence-based care, and many are showing promises that are in specific environments, specific populations. One intervention or a cluster of interventions which have been shown effective to reduce the risk of overdose is medication-assisted treatment, sometimes called MAT. Medication-assisted treatment includes methadone, Suboxone, and newer medication, Vivitrol. These medications are shown to reduce substance use and also significantly reduce the likelihood of overdose. There is also medication which is shown effective in crisis interventions. Naloxone, Narcan, is an overdose reversal medication used when a person is actively overdosing. The stepped care approach mirrors the zero suicide philosophy of providing care in the least restrictive environment. What it supports is consciously and through a series of guidelines considering medications and an approach which meets the patient where they're at, and if having difficulties with the medication or still struggling with substance use, to increase the intensity of the treatment, different medications, and increased behavioral health supports. Some of the mental health interventions which support medication-assisted treatment are motivational interviewing, SBIRT, which stands for Screening, Brief Intervention, and Referral to Treatment, and naloxone being provided particularly during transitions of care, and harm reduction information, overdose education. Now, it's important to acknowledge that these are being used as best practices, and although there is still need for additional research and evidence to show when and how these interventions are most effective. The Institute for Family Health is committed to providing evidence-based care and addressing substance use. In this graph, we show starting from 2007 until throughout 2016, our commitment to providing medication-assisted treatment throughout our network of care, starting with 15 patients and 65 prescriptions in 2007 to 411 patients treated in 2016. And the Institute has virtually every prescriber possible with the waiver to provide Suboxone, and many having a caseload of medication-assisted treatment patients. It's also included in our residency program and provided throughout our network as an available treatment. Continuing efforts to support that through behavioral health and increased capacity across our health centers. The Institute is also an opiate overdose prevention program. We are providing overdose prevention kits throughout our health centers, and this graph shows the cumulative trainings which we provided throughout 2017. And there are different levels of trainings. The red trainings are overdose responders. That means that I have a kit and I know how to use it. The blue shows overdose responder trainers. Now these are our staff who are trained in how to use the kit and also how to enroll and train others on how to use the kits. There's also the trainer level, which we are then able to train the responder trainers. Now, acknowledging that this area of treatment for overdose prevention, we need more care. However, the way that I see this is that it puts more weight on the other elements. Having a trained and caring workforce, having the policies and procedures within an organization's best ability to provide care consistently, while also collecting data, being involved in research that will lead to more evidence-based practices, and being involved in the development of evidence-based care using the best available resources and of treatment that are available and known at this time. I hope that as we move forward, there will be more evidence-based treatments available that support medications and patients at risk of overdose.